is Talia Elko, and I'm going to be presenting the pros and cons of breastfeeding for Psychology 240. What is breastfeeding? Breastfeeding is the process where a baby drinks milk directly from the mother's breast, and this is tied to physical nourishment, emotional bonding, and health outcomes for the child. Its relevancy to psychology is the effects on both the mother and the child, whether that be biologically, socially, physically, or economically, among others. Milestones for breastfeeding. I'm going to briefly go through this one, but first week, the baby's going to end up latching, so you just want to ensure that the baby's actually able to feed itself. 2 weeks to 2 months, there's going to be an increased demand for milk because the baby's going to end up having growth spurts. And around 4 to 6 months, the baby's actually going to end up growing baby teeth. And at this point, you can start introducing solid foods to them. However, you can still continue to breastfeed up to 2 years. Around this point, the mother's breast milk will mostly be water, but it's up to the mother and child whether they want to continue that or not. The World Health Organization recommends breastfeeding for at least 6 months, and this figure shows how many states actually do this. Most of them are relatively on the low side, but they're all about 50%, which is still good. Environmental influences. Region and cultural context does play a relatively big role because among different regions, commonality of breastfeeding is different, and this can promote some women to breastfeed more because it's more normalized there. And for culture context, different cultures perceive breastfeeding in different ways, whether that's positively or negatively. Here in the US, there's some controversy with breastfeeding in public because some people deem it inappropriate, and that may drive some others away from actually breastfeeding. Biological influences. Genetics does play a big role, specifically through the mother, of how well she's able to produce milk and what her supply is like and the composition of it. One of the genes that does impact this is MFGE8, and this is the protein in milk fat globules, and this can make it more difficult for a mother to produce milk. Epigenetics also does play a big role for the child because breast milk influences some of the gene expression, but doesn't alter DNA sequencing. Things like hormones is within breast milk, and things like the sleep hormone, melatonin, and cortisol stress do play some impact on the child's expression of genes. And then hormones for the mother is prolactin and oxytocin, and those vary between individuals. Pros of breastfeeding. Breastfeeding reduces infection for the baby, and this is because the baby ends up getting antibodies from the mother, and this reduces meningitis, ear infection, respiratory infections, and so on. SIDS is sudden infant death syndrome, and it's one of the highest causes of infant deaths. And breastfeeding actually does reduce this because breast milk has a component in it that allows the baby to wake easier from its sleep. Developmental improvements. There's correlations with reduced odds of developmental and social delays. However, those studies are correlated and not causal. And then also bonding. When a mother is breastfeeding a baby, there's skin-to-skin contact, and that allows for a better attachment style for the baby in its future. Pros of breastfeeding for the mom. There's a reduced risk of ovarian and breast cancer, along with a decreased risk of diseases such as type 2 diabetes or obesity and other things like that. And this is because for milk production, it's going to use glucose, and the mother's body is not going to end up storing as much of it. Cons of breastfeeding. The mother's health does play a big role in whether she's able to breastfeed or not, depending on if she has any diseases like HIV or active tuberculosis, and what she's consuming. If she's taking drugs or she is consuming alcohol at the time, none of these factors are going to allow her to breastfeed because it's going to cause adverse health effects in the child in its future. There's also breastfeeding difficulties. There's physical discomfort, whether the baby's actually able to last, and breast engorgement. So there's many things that could potentially cause issues there. And correlation benefits. Studies of breastfeeding are not correlated, or are correlated, but they're not causal. So there's no definite correlation or causal relationship between breastfeeding and its outcomes. References, and thank you so much.